Good morning, good afternoon, good evening, and welcome. Thank you all for joining this fifth session in the fifth thematic area of the UN World Data Forum. Today, we'll be discussing the dilemmas, prospects, and perils that face the humanitarian community in using digital technologies and data in the response to COVID-19 around the world. My name is Stuart Campo, and I'm the team lead for data responsibility at the UNOCHA Center for Humanitarian Data, based in the Netherlands. Today, the Center, the ICRC, and the government of Switzerland have organized this dialogue as part of an ongoing process to attempt to build trust and ensure that we're all working together and learning together around how to tackle the challenges and capitalize on the opportunities of data in the sector. Just to give you a quick sense of the structure of the event, we'll begin with opening remarks from two high-level speakers and then move into an expert panel for a discussion around the different dimensions of this complex issue. We'll have ample time at the end for Q&A. So either through Zoom or through the Attendify platform, I believe both are available to you, but we'd encourage you to use Zoom so we can keep everything in one place. Feel free to share any questions that you have, either directly for a specific speaker or for the audience in general, and we will tackle as many of them as we can before the end of the session. I think it goes without saying that this discussion is particularly timely as many of us begin to experience the effects of the second wave of the virus. As the abnormal becomes the new normal, we're trying to adjust and understand how to work better individually and together to make it through this crisis and learn from our experience. That's really the focus today, and we hope to have a lively discussion that we can carry forward as we all move ahead together. With that, it's my pleasure to introduce Barbara Shedler-Fischer, the Deputy Head of the Human Security Division of the Swiss Federal Department of Foreign Affairs. Barbara, the floor is yours.
Thank you very much, Stuart. Can you hear me well?
Yes, very clear.
Always the first question. So a warm welcome from Bern, Switzerland. We would have loved to welcome you all here, obviously. It's not meant to be this year, but very happy that we can at least meet virtually. On behalf of the ICRC, the OCHA Center for Humanitarian Data, and Switzerland, I warmly welcome you to this session at the virtual UN World Data Forum. The topic of this session is unfortunately very timely: data responsibility in the COVID-19 response. After a difficult winter in South America and constantly high numbers in the United States and other countries, the number of infections has dramatically increased in Europe over the last 2 weeks. Extraordinary times require extraordinary measures. Fortunately, there are simple but effective measures, such as social distancing, the reduction of social contacts, facial masks, and regular hand washing. We all know this. At the Swiss MFA, as well as in most private companies, we are back in home office mode since yesterday. In addition to these simple behavioral measures, technology can play an important role in the fight against the SARS coronavirus too. The world is waiting for effective vaccines. PCR and antibody tests are applied at a large scale, and contact tracing apps are broadly used. However, it is crucial to realize that public trust is a precondition for the successful use of these technologies. In the development and deployment of technologies, trust has to be factored in from the very beginning. In the case of the Swiss COVID contact tracing app, for example, it is thanks to the specifically developed DP3T protocol that many Swiss citizens have downloaded the app on their smartphones. In Switzerland, but also elsewhere around the globe, the protection and the responsible use of personal data is not a nice to have. It's a requirement, be it by law and by societal pressure. There are a number of precautions that all organizations can take to ensure the safe, ethical, and effective use of data. Applying data anonymization tools, seeking informed consent, and ensuring transparency at all levels. This means clearly defining the ethical framework and the purpose of data management, practicing data minimization and limitation of data retention, and last but not least, defining specific roles and responsibilities of different stakeholders throughout the data management process. What we observe now with the COVID-19 response is very similar to humanitarian responses and humanitarian action in general. Affected people only rely on technology if they are confident that they can be trusted. As in the fight against the COVID-19 pandemic, data protection and data responsibility are key. Technology can be tremendously beneficial, but it is crucial to earn this public trust and to avoid any state or non-state activities detrimental to democratic processes or infringing on human rights. Another important lesson that we have learned from this pandemic is certainly that we can only be successful if we firmly stand and work together. Similarly, regarding the protection and responsible use of humanitarian data, no single state or humanitarian organization can tackle these challenges alone. Inter-organizational leadership and collaboration is required to guide collective sector-wide action. Solidarity among practitioners, sharing best practices, lessons learned, and strategies for mitigating risk will also be essential to long-term success. To this end, the ICRC, the UNOCHA Center for Humanitarian Data, and Switzerland have convened the Humanitarian Data and Trust Initiative, the HDTI. We are now seeking the engagement of other states and humanitarian organizations. This should be a true collaborative effort. The initiative aims at accelerating the responsible deployment of data-related technologies in humanitarian action while minimizing potential risks and maximizing benefits for affected people. It is based on a rich body of previous work, such as the ICRC's Handbook on Data Protection in Humanitarian Action and the UNOCHA Center for Humanitarian Data's guidance on data responsibility. I hope that you can see the links to these works in the chat now, so you can check it out later on. The purpose of this session is to share our organization's perspective, to share our experiences on how to maximize the benefits of technology while minimizing potential risks. And it is a great honor indeed to have the World Health Organization, the World Food Programme, MSF, the ICRC, and the UNOCHA Center for Humanitarian Data at the virtual table today. It is exactly this collaborative spirit that will catalyze joint learning and collective action, and eventually it will lead to successful outcomes in the COVID-19 response, as well as in humanitarian action. Thank you very much.
Barbara, thank you so much for those inspiring remarks and for getting us started on such a strong note. You mentioned a few key themes that I imagine will be prominent throughout our discussion. And if there's one organization in the world that knows how critical trust is in the response against COVID-19, it is the World Health Organization. It's my pleasure to welcome next Dr. Samira Asma, who is the Assistant Director General for the Division of Data, Analytics, and Delivery for Impact at the WHO. Samira, the floor is yours.
Thank you, Stuart. It's an honor to be part of this distinguished panel, and I'm always impressed and moved by the work colleagues from OSHA, ICRC, MSF, and the World Food Programme are doing in the most challenging circumstances. WHO is always honored to partner with you and the organization colleagues. I will begin with reflecting Dr. Tedros's remarks. Promote health, keep the world safe, and serve the vulnerable. Serving the vulnerable is at the heart of WHO's transformation. Data shows us more people are on the move than ever before. Conflict, climate change, and now COVID-19 is aggravating inequalities and impacting the most vulnerable members of our society. I just recently read in India alone, an estimated 40 million internal migrant workers were severely impacted by the government's COVID-19 lockdown. With transportation systems at halt, the people faced harrowing journeys home. The point I would like to make is that we truly need reliable, timely, and actionable data to address these humanitarian challenges. So congratulations for the initiative that you've launched. Without data, we will be leaving most of the vulnerable even further behind. Let me give another example of the invisible billion, coined by the World Bank. People who are born without birth certificates, live without registration, and die without a death certificate, let alone we capture what they died of or the cause of death. People in terms of numbers are not counted. Refugees, undocumented migrants, asylum seekers, and internally displaced persons are also at increased risk of contracting diseases, infections like COVID, due to overcrowded conditions and lack of basic public health measures, including medicine and primary healthcare services. Moreover, lack of universal health coverage can lead and is leading to excessive out-of-pocket costs and leading to more a vicious cycle of neglect. So access to quality, affordable health services, healthier population policies, and protecting from health emergencies is of paramount importance to right-based health systems, global health security, and to reduce inequalities. And these are the basis for WHO's strategy coined in the triple billion targets. But while we promise health for all and UHC, how can we make sure and serve the vulnerable? So I have a few solutions here. We acknowledge that this is not an easy terrain at all for any institution and the people that are impacted. And it requires collective solutions and dialogues such as this one to offer new challenges of communication and action. So thank you for bringing us all together. WHO is humbled to support the Humanitarian Data and Trust Initiative, a very important one, and the recent launch of the handbook on data protection in humanitarian action. The Humanitarian Data and Trust Initiative plays an important role in supporting on agreed set of principles and data governance processes for vulnerable context. Extremely important. Trust is, after all, built through clarity of what will happen to the data as it is collected, stored, analyzed, and used. As I just spoke in the earlier session on trust, privacy, and data governance, it is the key to everything that we do. If we lose trust, we literally lose everything. We lose people's faith and trust in data. So we lose really everything. Yesterday, WHO also released its updated data principles and data sharing policy, which is not for health emergencies, but outside the health emergency context. As you know that the health emergency context and data sharing policies are under review right now. And this is an important aspect as we support countries' capacity to address data gaps and how we in the partnership with many stakeholders, intergovernmental, multilateral, public-private partnerships is going to be extremely important to refer and to use and implement our relevant actions based on these governance mechanisms. In closing, I would like to say leaving no one behind is really not supposed to be a cliche at all. And as I often say that we are less than 10 years away from SDG 2030, and we are already off track. We're off track, now more off track. 10 SDG indicators are related to migration and all the relevant populations that are vulnerable. and 24 of these are related just alone to data disaggregation. And this should be given a heightened priority by all organizations. We know that the number of people that are living in vulnerable settings is increasing, and they are counting on us to make sure that they count. I look forward to the discussion. Thank you again, Stuart. Over to you.
Thank you so much, Samira. I think that really gives us the right backdrop alongside Barbara's remarks for the rest of this session. And I also want to appreciate the fact that you have now been in virtual dialogue for several hours as part of the forum's event. So thank you again for making the time to join us. And we're really grateful to have both you and Barbara here with us. Just a reminder to the audience that we do have a Q&A with all of the participants scheduled at the end of the session, which Barbara and Samira will be online for. So if you do have questions, drop them into the chat, which, yes, I think it's a chat for you, or a Q&A box in Zoom. And there's also a chat channel in Attendify that our team is monitoring. I think the point on the most vulnerable is really critical in Samira's remarks, and it's a good segue into a panel where we will explore not what are the benefits and what are the risks of technology and data in the COVID-19 context, but rather whose benefits and whose risks are we really talking about here, and how do we think critically about balancing those, maximizing benefit and minimizing risk, and ensuring that technology is an enabler to the response to COVID and not an additional risk factor. Even though I love to talk about risk and harm, we will start with the promise and the prospects of data and technology in this context. So I'm really pleased to quickly introduce the panel and then dive right in. So we are joined today by Enrica Porcari. Enrica is the CIO and Director of the Technology Division from the World Food Program, and has been speaking throughout this response about the critical role that tools from the digital and the data-driven side of things can play in humanitarian action. We also have Mary Nunn, the International Privacy Coordinator for MSF, Médecins Sans Frontières, or Doctors Without Borders for those in Anglophone contexts, who has been really pivotal in thinking about the data protection issues on the ground in some of the most complex humanitarian environments throughout this crisis. Finally, we have Mr. Massimo Morelli, who heads the Data Protection Office at the ICRC, and who, in addition to driving forward the work around the handbook, has really been a leading voice on these issues throughout the COVID-19 pandemic. So welcome to our panelists, and thanks again to Barbara and Samira for your opening remarks. Hopefully on the screen now people can see our panel, and we will basically toggle through 3 rounds of questions before opening up to a Q&A. So as promised, we'll start with the promise of digital tech and data. And Mary, I'll come first to you. Drawing on MSF's experience, how have digital technologies and data enabled the response to COVID-19 in different humanitarian contexts?
Thank you very much, Stuart, and thank you for this wonderful panel that, as has already been mentioned, is very timely. In terms of how technology is being used to enhance our efforts, I think one of the really good examples that we can provide is the increased use of telehealth and telemedicine in our response efforts. And we've seen lots of positives come out of that. The first being the sort of notion that if we are to continue providing care, we need to make sure that our staff is safe and healthy. And so if we can increase sort of a remoteness in terms of the care we provide, then we ensure less exposure of our staff to the virus itself. That was especially important at the outset, where there was a real challenge in obtaining PPE. The remoteness also helps in terms of shielding high-risk patients, and to the extent that we can provide consultation and medical information to patients remotely, we reduce their exposure in them having to travel to our clinics and obtain care in person. Similarly, in terms of triage, if we can speak to patients ahead of time and ascertain their needs within their homes, then there is less of a need for them to travel, and then the knock-on effect in reduction of interaction and transmission within that context. I think sort of beyond the COVID specific element, there's also the notion of being able to continue to provide general medical assistance where we as an organisation in a position where we are no longer able to move because of various lockdown restrictions and various other logistical challenges, that has sort of bridged the gap in terms of continuing that rapport with our patients. Then similarly to that, there's also the notion of ensuring a certain continuity of care. So for patients that have sort of more long-term illnesses and health conditions that need management, the use of various technologies, be it simple telephones, be it sort of SMSs or health management applications, are also supporting in that effort as well. And then around COVID specifically, there's the notion of sort of the real public health messaging. I think it's no secret that in times of pandemic, getting the right health information to populations is critical. And we've also seen an increase in the use of multiple digital communication channels to extend the reach of that health messaging, and also to provide contact points for people who are looking for medical advice and support. Now, all of this is not without drawbacks. Obviously, there is an impact on proximity to patients, and there is a de facto increase in the data collected. But in these challenging times, it can be seen as being a sort of net added value within the context within which it is used. So ultimately, Stuart, it's not just that technology has enhanced our response, it's also allowed us to continue working during this time of crisis where direct access to patients hasn't been possible.
Brilliant, Mary. Thank you so much for that myriad set of examples and the real clarity on how tech has helped you stay and deliver in some of these really complex environments for critical health services, which frankly were already under strain, and COVID has made that just more complicated. We'll turn next to Enrica to share some additional examples, and maybe specifically, Enrica, we'd love to hear about some of the concrete benefits that WFP and its partners have seen from digital technology and data in the either direct response to COVID-19 or in the kind of context of delivering food assistance in the COVID-19 environment.
Great, thank you. Thanks, Stuart. And again, glad to be in this panel. You call this session the promise, and I always think that the promises we make compared to the promises we keep. And our promises have been to use reliable, secure data, to think fast, to act fast, to save lives, to stay transparent. And I think that COVID-19 has been an emergency on top of many others. And we simply could not have scaled at the level that we did without a solid digital platform to rely on. And WFP had been investing on a digital journey for a few years. We still have a way to go to be a truly integrated digital organization, but the groundwork that we've been investing on meant that the foundations were in place to adapt to COVID. So we weren't starting from scratch. We were able to keep those promises. We were able, like Mary said earlier, boots on the ground are a real challenge with travel restrictions and the spreading pandemic. So we had to provide all of our 19,000 staff with an opportunity to work from wherever they were at the time when they could no longer move. At the peak of the pandemic, WFP was the biggest flying, international operating airline in the world. And we were carrying 20,000 passengers. Imagine having to do all of that, moving 50,000 cubic meters of cargo in the most remote places in the world without a digital platform that we're able to provide an opportunity to control the traffic. In partnership with the World Health Organization, we launched an emergency marketplace, so over 60 organizations could book and manage the logistics of PPEs at the time of the pandemic. We were able to scale up faster the provision of cash to our beneficiaries at a time when remittances were really suffering. We used blockchain to cut camp access in our Rohingya camp in Bangladesh from 15 minutes to 15 seconds, again, lowering the risk of exposure, both for the humanitarians, but also for the people we were serving. We were able to disconnect the biometrics to be able to, again, not having to, for the beneficiaries to have to biometrically identify, and therefore exposing them to, again, risks of contacts. The list goes on. But if I can stretch just for one more minute, because these are technologies that we put at the service of the people that we serve for saving their lives. But I think we have an opportunity to also change their lives of those affected through use of technologies. Just imagine by investing in digital in some of these remote locations, we could keep the kids whose schools are closed. If you give kids the internet, you actually immediately now have a classroom, although children may not attend school. Family have access to legal, financial, and health advisors, as we heard from WHO. Small businesses can have better products, better markets, better prospects, because although transport is now moving, they can have digital access to that. And each of these could be a multiplier of benefits for the community and the country. So I think that the COVID-19 provides us a springboard to somehow rethink how digital can actually help us rethink the way that we change and save lives in many of the contexts where we operate.
Thank you so much, Enrica. And I asked for a few, and you gave a brilliant array of examples, which is really helpful, I think, to ground this discussion in all that can be realized with digital technology and data. And I think it also helps elucidate this point that digital and data are not just things that we do in and of themselves, but they really are embedded in how we do what we do as humanitarians across the sector. And then to the final point around this not just being an immediate life-saving discussion, but really looking to Samira's earlier point around the SDGs at how these technologies and the systems we're putting in place can support farther action beyond crisis, even while around the world we are still very much in the midst of this COVID-19 pandemic. Massimo, I'll turn to you now and allow you to kind of refocus on the immediate humanitarian context, which will unfortunately continue to deserve our attention, and ask you to look forward a bit. So based on our experience so far, how do you expect digital technologies and data to figure in humanitarian response contexts moving forward?
Thank you, Stuart, and thank you also for the possibility to participate in this great discussion. Well, we know that we've heard how digital technologies will play an incredible role and are playing an incredible role in improving our response, and there's no question about it. Also, from our organization's point of view, it is one of the clear pillars, digital transformation, one of the clear pillars of our institutional strategy and our information environment strategy. It was the case before COVID-19 happened. We saw that we already saw very significant forces that were already playing involving digital technologies having a primary role. So we're not really just talking about technology enthusiasm and tech solutionism. It's really this attention and this focus on technology and digital is in response to a number of key factors that are heavily affecting humanitarian emergencies, starting from the most basic and obvious and simple, the famous blanket problem, which is we need to see how far we can stretch the blanket to cover as all the needs that we have, the pressure to do more with less. We also have almost the moral and the operational duty to do whatever we can and whatever is within our means to leverage technology to do better for the people that are affected by humanitarian emergencies, in our case, by armed conflicts and other situations of violence. So these are some of the key drivers, but there are also some features of humanitarian emergencies that are unique and that we see panning in front of our eyes, where conflicts last longer. The average duration of the 10 most important operations where the ICRC has been involved is over 30 years. So it is in this kind of frameworks where protracted crisis overlap with fragile systems of social protection, where cash programs become incredibly useful tools for repeat assistance. And these are often linked to the use of biometrics, and we're increasingly talking about the creation of digital identities and the management of digital identities. Blockchain is often suggested as another tool that it takes part in this process. We know that conflicts become more volatile. For a humanitarian organization that is trying to have access to a conflict area and is trying to deliver assistance and protection, its mandate, it's difficult to understand who you need to talk to. Conflicts are more volatile and fragmented. Often the abundance of data enables you to, if you read it properly, to better understand your environment. We no longer have an army in red and an army in blue fighting with each other, and you know who to talk to. You need to understand and make the most of the data that you have to understand who you need to talk to in order to be able to have access and to influence conduct. So there, big data, artificial intelligence, and machine learning are technologies that are increasingly being used to help read your environment, read needs by affected populations. So there's also, I mentioned that it's more difficult to read our environments. That also means that it's more difficult to have access. And it's, in some cases, we need to find ways in which we can complement physical proximity and access with digital proximity and access. And perhaps it's not always possible for us to access, but it becomes important for us to be accessible and to be reached by people who are affected. So overall, globally, digital technologies really involve the possibility to leverage, generate, capture massive quantities of data. So it's not really surprising that in extraordinary emergency times like those of relating to COVID-19, we have seen an increased momentum in uptake of technology. Only a year ago, we probably would have never imagined the role that digital contact tracing could have had in complementing and aiding something that has been primordially a part of response to pandemics. Contact tracing is not something new. And but even just thinking of the opportunities that we have today to talk and to connect from across the globe, there are, I don't know how many people connecting and listening to us, and we have this opportunity to talk and to carry on working and to carry on learning and to carry on exchanging thanks to technology. So it's this is really there's a lot of expectation and a lot that has been delivered already by technology, and the future is just going in that direction. The picture is much bigger in relation to the response. There was a study, a compendium that was published by the United Nations Department of Economic and Social Affairs with highlighting over 500 types of applications developed in response to COVID-19. I'm reading now the categories: information sharing, contact tracing, business, e-health, e-participation, social distancing and virus tracking, digital policy, and working and learning from home. So we're talking about initiatives that range from chatbots in Singapore to drones in Oman, robotic medical assistants in Indonesia, virtual doctors in Brazil. So we're going to see it come, and there's going to be more.
Thanks so much, Massimo. It's a great summary of both what already is being done and what we can expect to see more of, as you say, in the sector and in some of the more complex environments where we all work as humanitarians. So I think it's critical to keep this in mind, the way that you described the use of digital and data in both our sort of run-of-the-mill standard core business as humanitarians, but also some of the new areas that both Enrica and Mary also gestured at. In order to really assess and then properly design digital interventions or data-driven interventions, it's not enough to understand and be excited about the potential benefits and the potential positive impact. And that's where we turn to maybe the more provocative part of the discussion, which I think people are likely tuned in for. So it's important to really dig into what are the perils, what are the risks of these tools, how have we seen those risks manifest, how have we documented them quietly or publicly, sort of individually at the organizational level or collectively, which we're trying as a sector to do better. And I think we'll hear some examples of. And then how do we really consistently help people in environments around the world identify, assess, and mitigate these risks? So this next portion of the conversation, we'll dig into that a bit. Again, as a reminder for people who may have just joined, we welcome questions for the Q&A in the chat or Q&A box, so please do keep those coming. So for this portion of the discussion, Enrica, I'll turn first to you and ask for you to share your thoughts based on WFP's experience of some of the main risks that accompany the use of these tools and of digital data in humanitarian action.
Well, Stuart, COVID is a crisis in what I call it digital times. When reliance on data is growing. I mean, I wake up every morning expecting data to come to my handphone and to know what's going on. And this reliance is closely linked to trust. I need to be able to trust the data that we use. So at the World Food Program, we have shifted the way in which we provide assistance by making one-to-one relationships with our beneficiaries. As Massimo says, it's the need to reach and be reachable. So establishing, a two-way communications means that we're able to better target, understand the needs, establish relationship, provide them with the assistance they need, helping them not only, again, saving lives, but change their life and give them new opportunities. To do that, we manage digital identities. We manage data about over 50 million of the people that we serve every year. And if data is all you have left, it's as precious as life itself. So the stakes are very high. There are huge risks of misuse, abuse, overuse, but also there are big risks of misuse. If we don't use the data that we have at our disposal to make better decisions, to better serve, to better hear and understand the needs. So while we need to mitigate the risks of what could go wrong, at the same time, we shouldn't miss the chance to do what's right. So always kind of balancing between what I always discuss with Massimo, the difference between protection and production. How do we find a healthy balance? So again, the trust that people put in us is enormous, and we need to ensure that the data that we hold in this trust on behalf of the millions of people that we serve is kept as safe, as secure as possible. And so we at WFP, we made a very strong commitment and that we are making very steady and clear progress to keep the data safe and secure by putting policies, practices, technologies to be able to deliver on that commitment. So as I said, with every risk comes an opportunity. With the opportunities goes back into the risk. It all goes back in how mature you are as an organization, as a sector, to balance it appropriately.
Thanks very much, Enrica. And thanks for reminding us that when we talk about the risks of these tools, we're not just talking about the nefarious acts and more extreme harms that we might imagine, but also the risk of not acting, the risk of collecting data and failing to use it, which sadly is more common in the sector, at least to our knowledge, and something that we all still need to work together to tackle, to increase the use and impact of data that we are collecting and managing. Massimo, I'll come next to you and hopefully in the context of COVID-19, but feel free to expand if it's helpful on other contexts in which the ICRC is working. Are there any concrete examples of harm caused directly or indirectly by digital tools or the use of data that you're aware of and you think our audience should use to reflect on the kind of balancing of consequences in this space?
Thank you, Stuart. So I think it's been said before today that in a way, this COVID-19 situation and pandemic is just exponentially magnifying what we have been seeing and what we see for a while now in relation to the use of technologies. And we've referred to the incredible promises and benefits and advantages that technology can bring. And somehow COVID-19 brings it to an extreme. But just in the same way, we can look at what we have been seeing so far in relation to the use of technologies to understand or have a sense of what types of risks we're talking about. I mean, ultimately, we need to look at the pre-COVID-19 situation to have a sense of where the risks are going, because we're facing very novel technologies and novel uses of technology with digital contact tracing applications. So it's difficult to have already a list of facts and concrete cases. And looking back at what we have seen in relation to the possible abuses and harm arising, we have seen, and I think we actually still see it on a daily basis in the news, how the intrusion of privacy of individuals can lead to surveillance and repression. And we're talking about surveillance from a government point of view, but also from a corporate point of view, which brings into the reflection a whole series of new elements also for a humanitarian organization when engaging in external third-party commercial processors. There's questions about loss of agency of individuals beyond the immediate harm, the repression, and so on. We see also how the leveraging of large-scale data and technology could lead to loss of agency. So these are somehow already well documented across the board, and they have been for a while. They're compounded in humanitarian emergencies, but less well documented, because by virtue of the type of environments where we work in emergencies, it's more difficult to see perhaps the immediate connection between action and consequence and involvement by a humanitarian organization in data collection and the consequence of harm, particularly when employing or using third-party processors such as in cash programs and using cloud-based solutions. The perhaps what we can say is there is anecdotal evidence in a number of documented cases, and we can look at all the great work that organizations like Privacy International have done through the years, going back to 2013, their report Aiding Surveillance that clearly lists a number of examples that they could document, and also the work that they did together with us in the humanitarian metadata study, and looking at how all the metadata that is generated as part of humanitarian programs could end up being exploited and used. So we see some of these anecdotes and examples, and we know from an analysis of the environment that the consequences of exploitation and surveillance can be much more severe for affected populations, where the stakeholders that have the capacity to carry out that surveillance are the very stakeholders that have a stake in the conflict, and that therefore will use that information to further conflict-related objectives. So this will have repercussions on the affected population. It will also have repercussions on trust. So to the extent that humanitarian organizations are participating in a system that generates all that information, that then lends potentially itself to be exploited, that can call into question the neutrality, impartiality, and independence of humanitarian action, call into question the trust, and in turn access by the humanitarian organization to conflict areas, but also access by people to the very humanitarian services that they need. So in relation to COVID-19 specific circumstances, we can see how the incredible generation of data that is involved in contact tracing applications, for example, if it is not properly governed through architectures like the one that has been mentioned by Barbara at the very beginning, that has its very aim, that of data minimization, could lend itself to an exponentially magnified impact in the same vein. We're only somehow at the beginning of the analysis of what the harm could be. We have worked with the Jackson School of Public Affairs at Yale to analyze some of these risks, and we will continue to monitor those. Some of these risks are linked also to the fact that extraordinary measures are being taken to gather as much information as possible. And then you see certain solutions that are developed for emergency dragging on and becoming the new normal. Without necessarily having the right governance behind. We have seen heightened legibility of populations through this technology, also linked and therefore enabling the kind of concerns and harm that I mentioned earlier. And we also have an information that is primed for misinformation. So these are some of the concerns, and we will continue working with our partners and with our friends in this area to better understand and analyze these concerns.
Thanks so much, Massimo. It's a sobering but really important overview of some of the issues that you and your partners are seeing and worrying about. And I like the way you framed the lack of visibility between actions and consequences in this digital or increasingly digitized humanitarian space that we operate in, because that is indeed what we're struggling with. We have anecdotal evidence or anecdata for the statisticians on the line of the risks and harms that are very real, but there's limited concrete evidence, which makes it difficult to get traction on these issues. Nevertheless, we know that these measures that are being taken, as you put it, the extraordinary measures and uses of technology that may be justifiable in certain circumstances in a public health emergency, but might last longer than they're intended to, can also have effects beyond the immediately humanitarian environment. So, Mary, if I can come to you and ask you to think with us about the broader societal effects, and that could be specific to the delivery of health and health services, or more broadly, based on what you're seeing from a data protection point of view, how have the deployments of these technologies and data systems created the potential for future risk and future harm? And what are some of those knock-on effects we should be watching out for?
Thank you, Stuart. I think the first point to note there is what Massimo raised, in that we are still at the beginning of understanding what the real harms are here. But if we think it through a little bit, there are lots of possible consequences. And I think one of the ones for me is that we slowly move into a position of the normalization of recording absolutely everything. And when we think about, specifically in the health sector, if you have a person-to-person consultation between patient and clinician, your patient will divulge certain information, and you'll have that human filter with your doctor or healthcare worker who will decide what to record and what need not be recorded. And similarly, if you're in person to person, you will be recording less metadata. There will be less information generated from that interaction. But when we're using, obviously, digital tools for that data collection, then de facto, we have very much augmented the amount of data that we're collecting. And that then needs to fit into a structure of processing. And so once those databases then exist, there are various sort of risks that relate to that, not least a risk in terms of data security. So there's the notion of, those databases have a high value to them, be it a commercial value, especially when we're talking about medical data, but also in terms of holding organizations to ransom. Now, we haven't, to my knowledge, seen that explicitly so strongly in the humanitarian sector yet, but we have in Europe seen hospitals that have had their systems shut down, and requests for payment being made on that basis. And if we rely too strongly on technology without backups, then hopefully it will never happen. But there is that possibility that we have our sort of hands tied at some point in terms of what we can actually do. So that's one element. I think the second element that is of concern for me is that there's a slow erosion of accountability, not only because we live in a world where misinformation, disinformation is becoming part of everyday life, and so it's very difficult to obtain clarity in terms of what is real and what is not, but also with complex technologies, there is a whole ecosystem of stakeholders involved in that. There are the people for who the technology is destined to be used. There are the tech developers, there are the humanitarian organizations, there are the governments, there are multiple other partners throughout the life cycle of the data, and it can sometimes be very difficult to get real clarity on who is responsible for what in terms of the protection of that information at any point in time. And so there's a real need there to sort of be focusing on that definition of responsibility ahead of time to avoid that erosion of accountability, hence the importance of these kinds of conversations. Then sort of specific to medical care, and staying with the example of telehealth, is that, you know, we need to also be thinking about the impact that has on our relationship with our patients. And as has been raised at multiple occasions this afternoon, the notion of trust being absolutely key, and how long can you uphold trust when you are working with that remoteness of relationship. I think also, you know, there is a question around what is the skill set required for medical assistance and medical activities. Of course, you need your medical expertise, but there is also a need to start thinking about, well, what tech expertise do you need, and how do we move from a very sort of siloed approach to medicine to a multidisciplinary approach to medicine, and what happens if we don't succeed in that. And I think, especially in medical terms, we also need to make sure that we continue to be able to identify the real needs and then develop technology accordingly, rather than moving into a society that is led by the technological development before the real need. So transposing that into the rather more thorny questions in a humanitarian context, I think there is a real question to be asked about, if we are investing heavily in telehealth technology, will that result in a lower investment in local medical expertise? And especially in the context of sort of post-colonial discussions and BLM movements today, I think that's a really poignant question that we need to be thinking about as we move forward in this use of technology. Again, in terms of closeness to patients, you know, are we still able to understand needs properly? Are we still treating people with the respect and humanity and dignity that we have committed to do so, if we are increasingly providing assistance from a distance? And then the final point to make is, and I think this comes back to what Samira started off with, are we sowing a greater divide? Because the more we rely on technology to meet our purposes of providing medical care, the more we exclude those people who do not have access to the counterpart to that technology, who don't have the devices to be able to contact us, who don't have the digital literacy to be able to use those devices, or very simply who live in areas of the world that aren't covered by that network coverage. And I think those questions really need to be considered to avoid moving into situations where we are creating a lot of harm in the longer term. But it sounds very doom and gloomy. It's not all doom and gloom. And I think ultimately the answer to your question, Stuart, is that the societal consequences in the long term will very much depend on how we act now in terms of the data responsibilities. And I think that again underscores the real importance of these kinds of conversations.
Mary, thank you so much. And that's a really great segue into the final portion of this moderated discussion. Just as a reminder for everybody on the line, we will have one more round of questions, and actually a number of the questions that have come through already kind of feed into this final portion of the panel, which is on the balancing of the promise and peril, or the opportunities and risks of digital and data. But then we will have at least a few minutes at the end for more open Q&A. So if you do have any specific questions, continue to drop those into the chat. Mary, one thing you mentioned really resonated, and that was that the use of digital technology and data should be driven by real needs in how we assess need and deliver assistance in response to that. And I think that's really at the core of how we balance the potential risks and benefits that these tools offer. So I'll ask everyone to be a bit briefer in your remarks to this final set of questions so that we do have time to address some of the audience's concerns. And I'll come, Massimo, first to you, just to get a sense of how you and your team, either within the DPO specifically or the ICRC more broadly, approach this balancing. What does that look like? Maybe what's one example of how you've looked at a particular intervention and assessed the risks and benefits, and then come to a conclusion of how to proceed responsibly.
Thank you, Stuart. So I would just like to start from where Mary left it, and really starting, as you said, from the needs. So in order to do a proper analysis and to balance the benefits and the risks, the most important thing is to start from the problem. What problem are we trying to solve, and whose problem we're trying to solve? I mean, for a long time, particularly, I think the debate around blockchain was a particularly interesting one, where for a little while it seemed to be a race to come up with an interesting use case for blockchain, rather than an analysis of what problem we had to deal with, and then finding whether there were solutions that were suitable for it, including potentially a blockchain one. So it was more technology driving a project than the other way around. And so that's one of the key points, starting from where the problem is. The second key point for me is knowledge and understanding and literacy. So we cannot really understand what harms and what risks can arise and how a particular technology can help us finding a solution to the problem if we don't understand the technology. And this is what forces us to really engage in the complexity of the technology and understand. So without this, I think we have two major risks. We heard about all the fantastic advantages and the benefits that technology can bring. We heard about the risks. If we don't have a solid understanding of the technology and what it involves, we will either be too scared to engage in technology and therefore just stay away from it, which is a very significant risk for all the reasons that I mentioned earlier, or sleepwalk into massive problems. So we can't afford either of those. We need to engage and understand the technology. And this is what actually one of the key drivers of our work in the last few years. The second one, the third point, is that we cannot do it alone. We really need more and more, and the complexity of technology forces us to really get together more and more together to understand and to find solutions. So we cannot really do things by ourselves. We need to have humanitarian organizations that understand the complexity of working on the ground and the use cases and the challenges that we have applying certain solutions. We need the technologists to be able to sit down with us and understand exactly the nuances of using technologies. We need data protection authorities and privacy commissioners to work with us to see how the solutions they had found for other problems they're dealing with can be useful for us to find a framework to navigate these technologies, and companies active in tech and academia to develop solutions that we do not have today that may be available to us. So ultimately, I mentioned some of the key points that take me back to the Humanitarian Data and Trust Initiative. This is exactly what we're trying to do together with you at OCHA, Switzerland, and to convene as many actors as possible to work with us in understanding, navigating, providing the right solutions, research and development, and literacy and training and education.
Great, Massimo, thank you. That gives us a good sense of already some of the practices you have employed as ICRC and some of the work that you see more space for as a sector moving forward. Mary, I'll come next to you with a similar question about risk mitigation measures specifically. So in your experience with MSF or with your partners, what are some risk mitigation measures that have proven effective in reducing risks related to digital technology and data in health emergency contexts?
I would do my best to be brief, Stuart, but I'm not sure that I can. Let's give it a go. I think the first point to note is, in terms of effectiveness, we are still in early days on many things, as has been said before, and time will tell. But I think one point to note in relation to that is the notion that mitigation measures are not a one-shot event. You mitigate, you monitor, you update, you review, and you mitigate again. And I think that's really important to bear in mind and to fit into some of the other challenges that we're facing and the reactive nature of some of our organisations. So to sort of make that a habit. In terms of how we approach mitigation, especially in terms of the protection of personal information. I think, we need to focus on having a solid foundation for that protection, and there are various legal frameworks out there that do provide a comprehensive approach to protecting data, and oftentimes they're seen as sort of prohibitors of technology, but if used appropriately, they do really force organizations to consider ahead of time, what are you using the technology for, what are the risks of doing that, and how are you going to go about managing those risks. So I have a whole list of things, especially from the GDPR, my choice piece of legislation. I won't go through them all in detail, but effectively things like, when you are engaging in new technologies or data processing activities with high risks, you have to carry out a data protection impact assessment. And that exercise in itself will allow you to identify the risks, evaluate them, and put in place mitigation measures, and then review those on an ongoing basis. There's also notions of privacy by design. So when you are developing technology, you need to make sure that data protection and privacy are integrated from the start. The list is long, and so I will only end on this one, which I think is particularly important and speaks to Massimo's point about not being able to do this alone, is that also, by applying the legislation, you will also find yourself not forced, but strongly encouraged to be really defining ahead of time the roles and responsibilities of the different parties that will be involved in the data processing activities and the development of the technology. And I think that clarity is key to ensure everybody is doing their bit and accountable for the security of that data. I'll leave it at that, but if you have any more questions about other things data protection related, I'm all yours.
Wonderful, Mary. And I think you will absolutely be taken up on that offer based on the activity I can see in the chat. Enrica, I'll come next to you to kind of round out this moderated panel discussion. And then in view of time and also the nature of the questions we've received, what I'll do is quickly summarize some of the open questions that our audience members have posed. And then we'll do one round of final thoughts for each of the speakers, including Barbara and Samira, where you can either respond to some of those specific points or offer another key takeaway. So there is your preparatory remark. But first, Enrica, of course, I want to give you the opportunity to also speak about this issue of balance and consequences, and maybe from the perspective of WFP's role in the sector and also your role and your capacity within WFP and the sector more broadly, how can we work more effectively together and collectively to understand and balance the risks and benefits of digital tech and data in the sector?
Well, I agree with Mary said, and it's like we don't know, and Massimo said as well, we don't know what the consequences are. So I think we need to be very agile and learn as we progress, as we deploy technologies, as we collect data, as we use it. We need to keep a very keen eye on what could be the unintended consequences to ensure the protection of the people that we serve. So at the sector level, we've been making commitments for more coordination and collaboration. And on the one hand, it means for the technology itself. So I agree with Massimo that it shouldn't be a technology looking for a problem, or as in the case of a multi-sectoral business like ours, or many technologies looking from many different actors looking for the same problem to solve. But nobody fleeing for their lives should ever have to repeat registration processes 20 different times because organizations in the UN and the NGO cannot get organized. And therefore we expose them to doing that, collecting different information. That's for us to fix. That should be our delivery on our commitment for coordination behind the scenes to understand what needs to be collected for what, to be able to make better decisions for the people that we serve. It shouldn't be just because we can, we do. Just because we can collect data, we do. Just because we can deploy technology, we do. So again, agreeing with my fellow panel members that we need to look at really what are we trying to achieve. On the other hand, is agreeing on what responsible, ethical, and safe use of humanitarian data means for all of us within the sector, with the government that we operate in, and increasingly with our private sector partners, where there are huge opportunities, but also huge risks. So we need to continue balancing. Just a couple of weeks, I was with Dr. Asma in a panel with the WHO, UNDP, and WFP, and we were looking at, around this crisis, less than 10 years ago to the SDGs with $2.5 trillion of funding gap. We looked at, again, these opportunities to collaborate and coordinate. And I think that our alignment behind the Secretary General's digital cooperation roadmap and data strategy must be the starting point, and need to coming back to it as a North Star. So we'll need to keep on renewing and adhering to our commitment to delivering on that promise. And I trust that this panel, like the many others, this event is, and the follow-up that we're going to have next year, will again move us closer to that North Star.
Thank you so much, Enrica. That's a really great note to wrap up the panel discussion portion of this session on. And I think a good segue into the final bit, which is where we'll hear from each of our participants very briefly to offer a final reflection or thought on what we've discussed today, and also what you see as the road ahead for the use of digital technologies and data in not only the response to COVID-19, but in the humanitarian sector more broadly. Quickly, I just want to call out a couple of the themes that have come through the Q&A chat in terms of issues that might be unsettled and that we might need to continue to look at together as a sector. There are questions around resourcing. How can organizations effectively resource expertise and investment in this area, given the broader funding gaps that the sector already is hampered by? And what resources are required, both in terms of raw investment, but also human expertise? Another area is this sort of humanitarian development continuum rather than divide, and looking beyond immediate crises to how we think not only about the SDGs, but about the really complex and interconnected data landscape, or really ecosystems in which we all operate as organizations in different capacities. So how do we tackle that continuum and the ecosystem issue through and beyond the COVID pandemic? One other theme that's come out, and then I'll start to come through the line to give you space to react, is really around the reticence, I would say, to discuss risk and harm, and whether that's because we don't know, or because there's a lack of data on current practices and the risks that might stem from those, or are there other reasons why we're unable as a sector to move beyond calling for more evidence? So just wanted to throw a few of those out there, and just right now we'll run through final remarks, and we still welcome any questions coming through. Of course, on the Attendify platform, we'll be able to track those and respond following this formal discussion. So with that, I will turn first to Barbara for a final thought or reaction based on this complex but rich discussion that we've had today. Barbara?
Thanks, Stuart. You're not making our job easier here with the additional questions, but good to see there are questions in the chat. So obviously there's interest from all over the world. Very happy to see that. I would like to pick up maybe 2 points that I found particularly interesting. The first one being the lack of visibility between action and consequence. That's also something we see in the field of human rights, for example, and also linked to this erosion of accountability that was mentioned by Mary, if I'm not mistaken. And I think that's a very big subject that we should look at. And I think that's also where transparency really comes in. And it should be transparency throughout the whole process. I said it at the very beginning. So you really have to be aware who is implicated, at what stage of the process, and what are the different roles. Linked to this, we've heard it at the very end, is monitoring. Really, I think it was mitigate, monitor, update, mitigate. So this constant process that I found very interesting. And the second point, the one that Massimo made on whose problem are we trying to solve. So really working on our literacy regarding technology, really become fit as organizations to deal with this, to convene different actors, to learn from each other, And this basically brings me back to the HDTI, to our initiative, where we really want to create this collective learning and to engage additional states, additional organizations for the advancement of responsible use of humanitarian data. So looking forward to that.
Thank you so much, Barbara. Samira, over to you.
Not much to say. Everything has been said, and very powerful messages. Technology and data, I think we are at a breakthrough point, and it is also a double-edged sword. It will help us to look for right solutions with speed and scale. So I think that is one side, but this cannot be done in the absence of policies and frameworks. And I think the Secretary General's framework is a starting point and a North Star, as was mentioned. We have data gaps, we don't know everything, but at the same time, we should not be relying everything on the digital panacea to solve every problem. My takeaway would be we must invest in people also to use the technology and also the partnerships. So partnerships are going to be extremely important. There are data gaps, but we know there is data. It's how we collectively come together and pool the data and make that available. There are technology solutions such as mobile phones and geospatial, etc. We know we will not have all the resources we need. So partnership is the solution for us. And what you have done by bringing us together, I think is already a big step forward. Then finally, I think the services that we provide, already mentioned, telemedicine, healthcare, self-managed care. So these are all very important, but again, has to be taken in a measured way so that we don't cause a divide, but rather close the gap.
Thank you so much, Samira. And that's really a great way to summarize a lot of the key points that have come through. Mary, next, over to you.
I'll avoid the temptation to go on about data protection. I think one key point for me is really, we evolve in a sector that is reactive by nature. We're dealing with crisis upon crisis, emergency upon emergency. And I think as difficult as it may be, it is worthwhile trying to carve out the time in there somewhere to slow down and really approach the problem in a very structured way and lay the foundations so that we build up a sort of data processing framework that is solid enough and comprehensive enough and has, as Massimo said, a sufficient enough understanding of what we're dealing with to then be better placed to incorporate all of these elements by design as we move forward to the next emergency and to the next crisis.
Brilliant. Thanks so much, Mary. Massimo?
Thank you. I think it's, I'm really glad that at least one of the outcomes of this discussion is not that we need more guidance, because we keep hearing all the time that we need more guidance and we need more guidance. We don't need more guidance. We just need to keep the North Star that has been mentioned right in front of us and to look at also the other elements of the constellation. The North Star is clearly the affected populations. We can't say, as Enrica mentioned, we can't afford to have people having to register 20 times. The person must be at the center. We can't afford to do harm inadvertently or recklessly by using the wrong technology in the wrong place. We have to keep the North Star, which is the affected population, at the center. We have the elements of the constellation. The guidance already exists. There are the principles and the tools, the documents that we have all work together to guide us. We have the partnerships. We have an incredible wealth of experts that can work with us from the technology sector. So I think we don't need more guidance. We just need to roll up our sleeves and start to work together on finding the right solutions for the affected populations.
Great. And in the spirit of rolling up our sleeves, Enrica, over to you for final thoughts.
Yeah, I usually agree with Massimo, but now I'd like to make a little just like a little comment, because I don't think we need to decide what's right for the people. I think we need to kind of shift that paradigm. I think we need to empower them with the tool to make their own decisions. I think we need to, in this digital age, we have the opportunity for more inclusion. We keep on talking about the 4 billion people who have access to digital technologies. Let's talk about the 4 billion who don't. Let's work together with partnership within the sectors, with private sectors, to actually provide this opportunity so they can shape their own future. They can decide what's right for them. And I think that we are at this juncture where really collectively we can make this huge shift where we don't have to be protective, but we just need to be inclusive in a way that they can, paint their own future. They can make their own decisions, and they can be actors and not only recipients.
Brilliant. Thank you so much, Barbara, Enrica, Samira, Mary, and Massimo, for your participation today. Thank you to our organizers at the UN World Data Forum and to everybody that has tuned in. We are indeed at an inflection point in the sector, and these issues figure centrally in how we will navigate the future. I think this discussion today shows how well positioned we are collectively and at the organizational level to do that in a safe, ethical, and effective way. But we need to continue the conversation, and we look forward to continuing to engage with all of you in the weeks and months ahead. Thank you all so much for joining, and we look forward to connecting again soon. Take care.